All right. Hello and welcome to our third installment of the regional report out calls that happen every week. This is the Southwest Regional Call that is at 4 o'clock every Tuesday. Today is December 29th, and we're grateful to have everybody with us here in this holiday week, making time to be with us. A couple housekeeping items to get us started. My name is John Rolfe. I'll be the host of this call. So if you are wanting to get on an email list to receive these calls along with the dashboards every week, you can go to covid.ks.gov/report-outs. That's covid.ks.gov/report-outs. You can also see a map of the regions on there if you want to see that. And we also have links to the dashboards and the calls on that website. If you have questions or comments that you'd like for us to consider on the next call, send us an email at ksregionalreport@gmail.com. That's ksregionalreport@gmail.com. And last but not least, if you're looking for a free place to get tested in your region, go to the website gogettested.com/Kansas. That's gogettested.com/Kansas. And you can find a place there to get tested. I will go over the dashboard that's provided by our friends from the Kansas Hospitality Association, and then we'll get color from our friends here on the call. So let's see if, Megan, if you can make me the host, I'll share my screen here. Thank you very much. All right. Okay. Now looking at this, you can see it's dated December 28th, which is yesterday. These are static numbers we're looking at, but they live in a very dynamic and ever-changing environment. So these numbers can change throughout a day, but this does give us a snapshot week to week of where things stand. So 18 hospitals in the Southwest region. One of the things we like to look at is the staffing. You've heard me say that the pinch points for hospitals are usually around staffing, stuff, or space. And staffing has been the pinch point more recently. A third of the hospitals in this region dealing with and anticipating staffing shortages this week. And then you can come and see how many COVID patients are hospitalized in your region, and then here into the ICU beds. So there's 22 adult staffed ICU beds. 5 of those are available right now in the region. That's making 23% of the adult staffed ICU beds available. And then plenty of ventilators available. And then I'm going to give a little more detail looking into the COVID deaths. Governor asked about that this week. I think it's just the trailing day when everything else is looking back a little further than that. So we'll figure that out. But here's some good news. This is the new case count in Southwest region. We're seeing a similar pattern in the Northwest region. So Western Kansas is getting some reprieve from the spike that we saw in November here. As it comes down from that peak of almost 1,300 to this last week, we only had 390 people test positive. But I will say, I'm going to switch over here. Dashboard put together by KDHE for us. And if you go to hospital capacity on their stats page, you can find the HCC percent positivity. And so they break it into our 7 regions, which we're grateful for. So here in Southwest, this bottom line of dots, you can see on the legend here what that means. If you're over 5%, between 5 and 10% positivity rate, you're yellow, 10 to 15, orange, and over 15, you're red. And if you highlight over the bubbles, you can see how many tests were given. So, looking back at the beginning of November, 3,200, right around 3,300, then up to 3,800. Week of Thanksgiving, 3,000, 3,100. And you can see the positivity rate also trailing with that. And then just under 3,000. And then that started to backslide a little bit. So 2,600, and then last week, 1,500 or just under 1,600. That's in part really because of the holiday falling in during this week and the patterns around all that. So still number positivity rate been getting better, but still higher than what we'd want. So we appreciate KDHE putting that together for us. Back to our dashboard here. On the second page, you can see the percent of the population from these counties that have tested positive for the coronavirus. since it started. And then you can see a census of the patients in the hospital in the ICU beds. And generally, our hospitals are near capacity this time of year dealing with non-COVID patients, but have had to move a lot of things around to deal with the pandemic. So that's a look at the dashboard. And oops, sorry about that. And I think I can let Edith in here. Okay, so let me kick it over here to Mary to get a little color from the hospitals. Mary?
Well, good afternoon, everyone. Thank you, John. My name is Mary Adam. I'm the director of the Pioneer Health Network. We're a network of hospitals based in Western Kansas. Today, I represent 18 of our members located in the southwest corner of the state. And our numbers have been high beginning before Thanksgiving, as you saw on the graph that John shared. And they are down considerably, which we are glad to see, to below 400 in the last week, positive cases. And that's basically what I've been hearing from our hospitals, is that they're kind of plateaued. They're in a stable area. Some even said it's calmer now. So that's good to hear from our hospitals, because right now they are ramping up for the vaccinations. They began giving the vaccine, the Pfizer vaccine, last week, and the Moderna vaccine they're receiving this week. And so this gives them a little bit of a reprieve to get people tested, to give vaccines, and just hopefully got a little bit of a reprieve over the holidays. As far as our statistics, I did want to say that we've mentioned this before, that our adult staffed beds is higher this week because we have more staff back to work. We have just as many COVID patients in our ICU, but we have more adult staffed ICU beds available this week. So that is good. Our staff is getting back to work from quarantine, from having COVID themselves. And, you know, as I'm sure they've said on the other calls, we are waiting to see what will happen after the holidays. And we hope that we won't see a resurgence of the illness and the positivity rates. Just a reminder to everyone, please continue to be vigilant. Wash your hands, watch your distance, and wear your masks. Even though we're getting people vaccinated and our numbers are down, we need to remain vigilant in those areas. So would you like me to turn this over to Marcia now, John, or?
Let's see if Edith has anything from public health,
Okay.
just an update, color around the numbers, and then we'll kick it.
Sorry, I had a little technical difficulty logging in.
It's still 2020.
Yeah, hopefully that will improve. So I just really kind of what Mary said, our numbers seem to staying down, at least around in our county.
And Edith, can you introduce yourself? I know you're from.
Yes,
Scott
my
County.
name is Edith Charingo, and I'm the administrator at the Scott County Health Department. We are a small health department. I have, right now I have an extra nurse, but most of the time we only have 2 nurses, myself included. So it's been a struggle trying to keep up with meetings. We just received our vaccine yesterday, so today was a lot of meetings with our community partners as how we're going to go about following the steps that the KDHE has provided for us. So a lot of meetings today, so that was kind of hard to keep up, but we're glad that we have the vaccine here. It feels like it's a little flickering light at the end of the tunnel, which is almost gives me the chills. I have time for myself to get the vaccine, so I'm pretty excited and nervous at the same time, but definitely, I think that's kind of what we're dealing with. We just had a meeting with our region, and same thing with them, kind of got together as far as what we all are planning on doing. So that was, that's always reassuring and helpful for us that you have other health departments that are dealing with the same thing you are. So that's kind of one of the things that keeps me going, and I think keeps them going too. We're all on the same direction. So very thankful for that. And so far, we're just hoping our cases don't jump up again after the holidays. Right now, it's kind of, we saw that before. It was like a little calm before the storm. Hopefully that doesn't mean it's going to happen, but I guess we're kind of, it's happened before. So, but that's about it. There's not a whole lot new. It's just kind of the same thing as last week. So
thank you very much, Edith. We appreciate it. And thanks for taking time. I know it's extremely busy getting ready for the vaccine rollout. There's a lot of details with that. So thank you.
thank you.
Mary, you want to kick it over to Marcia?
Yes, today I would like to welcome and thank Marcia Jameson. Marcia is the Chief Nursing Officer at Western Plains Medical Center Complex, I'm sorry, in Dodge City. Dodge City has one of the 3 larger hospitals in our region, including St. Catherine and Garden City, Southwest Medical Center, and Liberal. And so Marcia will be providing us a idea of what's going on in Dodge City, at Western Plains Medical Complex, and in Ford County. Thank you, Marcia.
Well, thank you guys for having me. I just have to reiterate what Marion, is it Edith, have said. We have seen a decline in the numbers as well, and I just pray that that continues. But, you know, being prepared for a surge is what we've been working on since I've gotten here in May. You know, our top priority continues to be protecting the health of our and safety of our employees, our providers, our communities. So, you know, that's always been our biggest goal. I truly hope that we are on the decline and that we won't pop back up again. My one saving grace is that vaccine. It gives me hope. I feel like, you know, as the country goes towards vaccinating all of their community members, that we're going to be able to see the other side of it. You know, when this has gotten really at the height of it, there wasn't a whole lot of hope. You know, of course, we were told the vaccine is coming and we'll have it, but we didn't have it. So now that we have it, it truly gives me hope. We started vaccinating our staff week before last. So we've gotten the first of the Pfizer and the A1 team vaccinated, and we're looking for Moderna end of this week. So we'll probably start the January 4th around in that area, that week of vaccinating the rest of our employees. And we've reached out to our health department here to, you know, start those conversations of what are we going to do when we finish vaccinating our staff? How do we help the community here in Dodge? But, you know, so those talks are started. They'll be getting theirs probably around the same time. And we're just going to come together and see how we best can get everybody that wants a vaccine, because that is my goal. I want anybody that wants one to be able to get one. Essentially, unless there's questions you guys have, I'm at a very good place right now. You know, of course, we've felt the challenges and felt the surge, and just like the rest of the communities in Kansas have had staffing issues and things like that. But at this moment, we're at the best place that we have been since the pandemic started. So I'm very optimistic.
Thank you, Marcia. And how would you describe kind of the mental health of your team and all that as you?
Well, I think it's better at this moment. They have been very tired. Our staff are very dedicated to this facility and really great professionals. They have worked night and day. We have rearranged schedules, just to make sure that we can accommodate what we need to, and to make sure that we have the staffing that we need. They're tired. They're ready for a break. We just, like I said before, praying that this will continue for a little while so our staff can get a break.
Thank you very much. I know you're super busy. Thanks for taking time to be here with us. We also have on the call Dr. Watson, who's been a practicing Kansas physician for some time and helped found Cheyenne Mountain Software, which is a software called Mission Control. It's been rolled out across most of the hospitals in the state. And he has some regional specific data as it comes to transferring patients. We spent some time on patient transfers last week, as that's where the system gets clogged up, and he can show us some live information. So I'll pass it over to Dr. Watson.
Great, thanks, John. And the current dashboard we're looking at for Southwest Kansas shows us exactly what everybody's sensing, I think. The things I think are interesting here, the percent positivity or suspected COVIDs for Southwest, much lower than the rest of the state. And we're transporting a lot of patients out of the Southwest, but we're seeing a decreasing percentage of those are COVID suspected. We're also seeing that only 18% are needing help finding placement for those patients, which to me is very, very encouraging. It speaks to capacity in the system, both on a local level as well as then at the regional referral centers and the tertiary care centers, which to me, very excellent. The acuity rating, the severity of illness with these patients have been pretty stable. And I think it speaks to the fact that the disease is certainly is staying the same, relatively so, and the people that normally would transfer are transferring at the same acuity level. I will say when we do have to find a bed, it's taking 3.5 hours typically on average to find a bed or placement. And I'll say that this number is affected by a few days that we had around Christmas. They're actually, and I don't know whether it was related directly to volume. I know there was an increased volume the day before and the day after Christmas, but I think also some staffing issues of trying to give some break to staff. We also experienced a higher demand because of that. But I think because the fewer patients need a bed, that this number is the exception now rather than the rule, and really encourage, particularly for Southwest Kansas, that very much on the backside of this surge. And I think it will be interesting with as many people that were moving in the U.S. over the Christmas holidays. Is that going to affect our numbers or is it not? And I think everybody has spoken to that while this is a breather and a little bit of a moment to gather ourselves again, I think it is a point to say the first 2 weeks of January will be telling as to, are we really seeing improvement here, or are we going to be in for the long haul? It's Groundhog Day essentially. So hopefully by the end of the month, January, we'll have a very good idea that we're on the backside and we can look forward to February. So thanks to everybody doing hard work, and certainly it speaks to what everybody's had to go through to get to this point. It seems like each region has to go through very hard times in order to get to the place where we get beyond it. So thanks, and look forward to the end, I hope.
Dr. Watson, let me ask you just a couple of questions here that I know. So when you go back to the 3-hour marker there to request and find a bed, it's also interesting to note the median transport duration. So that's the highest I think I've seen today. This is our sixth call, sixth region. That's 3 hours and 20 minutes once the transport gets there. And I'm also noticing, so now it's changed to the ground. When you look at the overall, it was fixed wing was the higher, I think, on the total transfers. So can you speak to those two elements real quick as it relates to Southwest?
Yeah, I think the transport duration is affected by two things. One is mode of transport. Obviously, if you're going by ground, that's a different time frame than if you're going by air. But also, if you're covering a lot of distance, regardless air or ground, your number goes up. So typically what this means to me are two things in the wintertime. Number one, the weather's bad in the winter, and we get days where we cannot fly aircraft and we have to use ground transport, even for more severe patients. And so that number gets longer. But I think also as it speaks to patients having to go further distances, and as you look at some of the destinations and you realize that there are more patients that are having to cross the state or go into Colorado to find placement, that in and of itself is going to increase transport times. So we realize that the wait time is only half of the experience. The other part of that experience is the out of hospital time, the time it takes to go from one facility to another. And we realize that all of those things go into, we're talking about an 8-hour, 7-hour day for patients here once the decision is made to move them. And somebody who's critically ill, in this case, we're seeing acuities of 11, then that means that they're very sick and we're moving them very long distances and sometimes not necessarily the fastest method just because of weather constraints.
Yeah. And I think part of the concern too, so we're looking specifically at the Southwest region, and I probably should have pointed this out on other calls too, but we start off at 1 o'clock with Kansas City Metro, at 1:30 with South Central Kansas, where Wichita is. And those hospitals are closer to capacity than even what we're seeing out here. And that impacts the ability to transfer your more acute patients, their mobility into those hospitals that have maybe a little more expertise, more tools, more medicines at their disposal. And so that's part of the regional calls. And as we see those issues pop up, we'll be sure to let the Southwest region know. But that's why you start to see people maybe being transferred out of state or to other places or places that are further away.
Yeah, and I think the regions, the rural regions, they're keeping patients that they typically or might send out even sicker than usual just because they know the difficulties of being out of the city, having to go across the state to find bed, family members and how they're involved with or not involved with the care becomes really difficult. And so fortunately able to move some of those patients in and out of the hospital fairly quickly, as opposed to the very sick patients in the urban areas, Wichita, Kansas City, Denver, where those patients can be in the hospital 3-4 weeks, and particularly the ones that have required ventilators. It just does not clear out as quickly, and so those changes are buffered, and you don't see the system doesn't unclog as easily at that level. Certainly, as we see the population in Southwest Kansas get healthy, that's going to be a big thing for the urban centers as well, knowing that they're not taking the numbers they had taken out of this area.
Marcia, anything you'd like to add? I saw you nodding your head during part of that.
Well, I really want to say thank you for the mission control. As you can see on that, on the metrics here, that we have partaken of mission control quite a few times, and it really has helped us a lot. You talk about 3 hours. We have spent hours upon hours trying to find beds and gone from, Texas, Oklahoma, Denver. So we really appreciate that, and it has been a lifesaver.
Well, thanks for saying that. And you're right. I mean, we look at some of these and each day we do quality review on each of the patient movements that we have, and we'll see 75, 100 notes and maybe 30 facilities that have been contacted in 4 or 5 states. And you realize that this is not an easy event, and it's 24/7, regardless of holidays, regardless of anything, it's ongoing. So I think it's reflective of everyone out in the small towns doing hard work. I mean, this is hard work, and I think unless you've lived that every day and realize the responsibility to the people you meet in the grocery store and at church, you don't understand what it takes out of a system, out of a county, out of a city to be able to meet the needs of the population. So really appreciate it.
We have an ER with 1 man. So to take our ER doc out of the game with trying to find the hospitals and the doctors to take these patients, it truly is a wonderful thing y'all have done.
Well, thank you.
Thank you.
Thank you. Anything anybody'd like to add before I wrap it up? Mary or Edith? Okay. All right. Well, let me make a couple announcements here. So one, anytime there's, global issues like this, there's people that try and take advantage of the situation. And there are vaccine scams going on out there. So I have 3 bullet points provided to me by the KDHE of things that they know are going on. So you might make mental notes or share these with folks that may be susceptible to it. This is attached to this week's email. The scams going on. One, I got 3 of them. One, you will not be asked for money to enhance your ranking for vaccine eligibility. All right. No one should be asking you for money to move you up in line. Number 2, government and state officials will not call you to obtain personal information in order to receive the vaccine. So no official will be asking you for personal information over the phone. And number 3, you will not be solicited door to door to receive the vaccine. You will not be solicited door to door. No one should be showing up at your door. So important things to remember. We also have a lot of unemployment fraud going on. The Kansas Chamber of Commerce had mentioned that to us. It's happened to me twice already, and I know many people. So if you're employed anywhere, just something to be aware of, and an eye open that there are people trying to file for unemployment under people's names across the state, and you can handle that with the State Department of Labor to let them know what's going on if you run into that. So just a couple housekeeping items around people trying to take advantage of a bad situation. Now let me move to bright spots, because we like to end on a bright spot. We like to catch people doing something right, knowing in dark times that lights shine even brighter. I like this one here. A church in Garden City is providing what they're calling mental health encouragement bags. Now these are coming out of the Kansas Leadership Center is doing a Stop the Spread series of community meetings, 1,000 of them across the state, and groups are taking on challenges of how to help stop the spread. This church in Garden City is providing mental health encouragement bags with the goal of uplifting members of their church, the county health department, and others in the community who are working hard to slow the spread of the virus. So it's just nice to see them encouraging others, because it has taken a strain, just as Dr. Watson was talking about. These are your neighbors that you're caring for, and it's just nice to see people leaning in with that kind of encouragement. So there's our bright spot for the week. We will be here every Tuesday at 4:00. Talk about the Southwest region. Please share the word and have people sign up at our website, covid.ks.gov/report-outs. covid.ks.gov/report-outs. Everybody, thank you for your time. I know you're very busy, and we wish you a happy new year. We'll see you next year or next Tuesday, one and the same. And have a great new year. Thank you, everybody.